Support for Radio Friends comes from OsteoStrong. Improvements in bone density, strength, and power can be achieved by weekly 5-minute no-sweat sessions on their 4-spectrum machines. These isometric robotic machines safely emulate high-impact loading on different parts of the skeletal system, which stimulates activity in bone-building cells. Balance and agility can be improved by 2-minute sessions on vibration plates. Every session is supervised by a trained coach. Learn more on Facebook or call to set up a complimentary wellness assessment and session. Good morning and welcome to Radio Friends on this Wednesday, July the 28th. We're going to talk about trauma in our mouth. And we have two experts with us, the husband and wife team from Columbia Healthy Smiles, Dr. Philip Batson and Dr. Elizabeth Abe. And I'll say aloha to you, Elizabeth.
Aloha.
Good to have you here.
Thanks for having us.
Trauma. We've not talked about this before in our dental segments, but trauma is something that can affect you when you least expect it. Let's say you're out playing softball and you get hit right smack in the face or in the mouth with a ball, and it knocks a couple of teeth loose. What do you do in a circumstance like that?
Great question, and that is something we've seen things similar to that come into the office. And so, for example, if you get knocked and say the teeth get knocked out,
I mean, if they're
the
totally
teeth are
out.
fully out. So in that situation, see if you can find the teeth. And if you can, just be careful when you pick them up. Pick them up by the what we call the crown of the tooth or the biting surface of the tooth. Don't pick it up by the roots.
Why is that?
We want to keep the roots as least contaminated as possible. And so pick it up, hold it by the crown. If you can brush dirt off gently if there's any dirt on it. And then you want to either put it back in your mouth or you want to put it in a glass of milk.
Glass of milk?
Milk. You do not want to rinse it under tap water, and you do not want to put it in tap water.
Now, wait a minute. You said put it in your mouth. Are you mean trying to stick it back up where it came from?
If you can. If you can't, just hold it in your mouth because the fluids and the saliva in your mouth is good for the tooth. So you can either try to put it back in the socket, or not, depending on your pain level and where things are at. But if you can just put it in some milk, call a dentist immediately and try to get in as soon as possible, preferably within 30 minutes or so or an hour.
Now, what if this is after hours, after all the dentist offices are closed?
Some offices have after hours numbers or able to come in after hours, especially if you have a dentist that you're a patient with who you have a history with.
Right.
They might be able to see you after hours. If it's a situation like that where it's been knocked out. And then when you get to the office, they'll take it from there as far as evaluating the tooth and hopefully being able to put the tooth back in the socket and reposition it and let it begin the healing process.
Okay, let me ask you. I've never heard of this. So if your tooth is actually knocked out and you pick it up, you go to the dentist, you put it in your glass of milk, and then they can possibly reinsert that tooth. And how are you going to keep it? How does it stay in your mouth once it's been knocked out and the dentist reinserts it? Do you put something there to hold it in place?
Yeah, so they would stabilize the tooth, and then that just gives the tooth the best opportunity to, survive and reintegrate into.
So it can grow back together in your mouth?
It can. It's going to require more than just placing it back in your mouth, but that would be the first step towards trying to save the tooth.
If it can be restabilized,
Yes.
and create some stability with a splint or something, eventually
holding it in
place. Eventually, that tooth is going to require a root canal because the nerve will have been damaged in all this trauma, but the tooth can reintegrate into the mouth.
Okay, so then the muscle and the gum is going to grow back around it, and will it be as strong as it was before as far as being firmly set in the gum? Or is it always going to be a little bit loose?
No, if it reintegrates properly, it should be good.
I didn't realize that. Okay, so that's the big thing, if the tooth comes out. But what happens if you have an incident and you just knock a tooth loose and it's wobbling around in there but it doesn't come out. It doesn't fall out. What do you do?
So you would also want to call your dentist,
Right.
and just have an x-ray taken, for like, why is it loose? Is there a fracture like within the jaw, or is it just traumatized in a way that we can stabilize it? But again, with any sort of trauma to the mouth, a root canal is potential, either whether it's 2 weeks later or 2 years or longer.
But you're probably
than
going
that.
to have a root canal.
Potentially, yes,
Yeah.
depending on how your tooth was traumatized.
Okay, but if the tooth is knocked loose but it's still there, it can restabilize it with help.
Yes.
Okay.
And to differentiate, if it's an adult tooth, if you can try to reposition it yourself, before you even come into the dentist, try to put it back in the alignment where it was.
I can't imagine doing that. I can't imagine doing that.
But we do want to say if it's a child that falls or something hits and knocks a tooth loose, if it's not their adult tooth that's come in, if it's still what we call their primary tooth or their baby tooth, don't try to reposition it, because reposition it, you can actually do damage to the adult tooth bud that's developing below it.
Okay, so if it's still the baby teeth, just let it go, but you should call your dentist.
Call the dentist, get in for a dentist to look at it, take an x-ray. Most likely that baby tooth might have to be removed, but don't go and try to reposition the baby tooth, because you can do damage to the adult tooth that's developing below it.
Okay, what if you just happen to, like your front teeth, what if you get hit in the mouth there and you just smash half of that tooth off? I'm sure you've seen that.
Yep.
You smash half of it off, but it's still firm in the mouth. What do you do there?
So depending on where it fractures, so if it involves the nerve of your tooth, then a root canal would be required. If not, then sometimes we can just do a filling. But again, whenever you have trauma to your teeth, it's kind of a ongoing process, and sometimes you may end up needing a root canal down the road.
Okay, but you can probably fix it up by filling in that chip or putting what do you put? Ceramic?
The tooth-colored resin filling can go in on that if it doesn't involve the nerve right away and there's not pain. Sometimes we can just be able to do a repair to get that chip fractured part fixed.
All right. Well, we're out of time. I had no idea that you should try to put your tooth back in yourself before you go to the dentist. But if you've got any questions, you want more information, the husband and wife team of Columbia Healthy Smiles, Dr. Philip Batson and Dr. Elizabeth Abe. What's your phone number?
It is 573-875-7071.
Okay, or you're on...
We're on Facebook, and our website is www.columbiahealthysmiles.com.
Okay, and remember, brush your teeth, floss, water pick, just take care of them so you keep the teeth. They're meant for your whole life.
Absolutely.
All right. Thank you so much for coming by. I appreciate it. Something you'd like to hear or see, I'd love to hear from you. Drop me an email. That's pepperp@missouri.edu, and have yourself a nice day. Okay? Bye-bye.